Any questions, everyone, before we get started? None? No questions. I see people were sending stuff on my email. Some people didn't send it, some people sent it. Any questions on that?
How were you supposed to send it, Dr. Smith?
Yeah, when you get a any type of exams, quizzes, or assignments, it will be uploaded on the Moodle. Very, very good questions. Thanks for asking.
Okay.
Okay.
So that particular assignment was not supposed to have been uploaded to your email then?
No, if you check your no, nothing is to be uploaded to my email. Nothing.
Okay, so you would have a drop box in place then for that, so we can resubmit.
If it were to be submitted, I was wondering where persons got that from. I just told you guys to do it. I didn't say it was an assignment to be submitted.
Oh, okay. Do apologize.
No problem. Not at all. But that was a very good question to ask, because after class, people will decide to inbox me. I'm asking questions now. If you have any questions about anything before we get started.
Okay,
yes,
another question.
I have a question.
Go ahead, Mr. Raming, and then Pakistan.
I've been studying some of this stuff, and I want to know that I see that we are doing inflammation and we doing the disease process. But when I look in the Patho book, they have like epigenic topics, like epigenic disease and factors and the Patho behind that. So I'm saying, do we study this stuff here, or do we study the stuff in the book as well? Because the book has a lot of, it goes into like a different detail than what we are actually doing now.
Okay, that is another good question, Mr. Raming. What we're doing now is we're building the foundation to get into what is called the alterations of body systems. So in order to do that, we need to first understand the pathophysiology, etiology, disease process. Now, today, I would have given you this exact same video, this assignment to watch, but I'm going to go over it with you, because inflammation and fluid balance plays a very, very, very important factor in the basis of alterations. Remember in the first, well, maybe the second lecture that I did, I spoke about homeostasis. Homeostasis is the body trying to find balance. When the body is trying to find balance, it either goes left or it goes right. When that happens, there's change in fluids, there's change in the immune system, there's change in blood pressure, there's all sorts of changes going on internally in the body. We need to first understand that. So all we're doing is we're building, and then we're gonna get right into the disease process. So you are absolutely correct. In the assignment, I started you by having you identify several diseases, then you were to categorize them, and then you would give treatments, actually. All right, that is to get you to start to think in that direction. So you will see that these tools that I'm giving you will be beneficial in another few weeks. But you are right. The textbooks are assigned, as you can see, chapters on the side of on the syllabus that tells you what chapters you should be reading simultaneously with us. And then, of course, you come to class with questions, you know. Once you would have read, you would come to class. If you do have questions, you know, don't wait until you're doing the quiz. Go ahead, Pakistan.
He basically asked the same question that I wanted to ask, but not so intelligently.
Mr. Raming, that's a compliment.
Well, thank you.
Ms. Ferguson, any questions?
No, ma'am.
I have a question for you.
Yes, ma'am.
When is the exam?
The exam or the test?
the exam or the test?
I'm not sure which one you're meaning.
The next one that's coming up.
The one on the, I think the 28th.
I don't know, I asking you.
I believe it's the 28th.
Okay, well, keep believing, no more questions, let's go, let's get started then. That's a question, right? So you guys, like I said, I am here, I'm asking questions, I'm gonna go into our lecture, okay? So please don't sit here and be afraid to ask questions. So the first day of class, when we had that little confusion, I told you guys to just go on their port and go ahead and do this assignment. And hopefully you did. I am so glad that Mr. Raming brought that in so that we can just tie it into what's going on now. We've looked at the disease process. We've looked at the causes, the etiology. We've defined pathophysiology. And now, today, we're gonna just go ahead and we're gonna look at the inflammatory process. So the disease process, now the inflammatory process. If you can recall, one of the disease in the categories was inflammatory inflammation. We will learn to understand that any type of alteration in body system comes the inflammatory process. You have a headache, is an inflammatory process. The headache actually is a symptom caused by your immune system responding to something, okay? You get bitten by a wasp. The swelling on your hand is actually the inflammatory process occurring. You get stuck with a nail. You see the swelling and you see the the pus coming up. The pus is a part of the inflammatory process. A pimple on your face, Ms. Toussaint. When you pop the pimple, that pus that's coming out is a part of the inflammatory process. All right. Notice after you pop the pimple, it's even swollen, a part of the inflammatory process. Redness, swelling, pus, warmth, they are all a part of the inflammatory process. Are you guys in the health assessment? Are you guys in health assessment and pharmacology and fundamentals? Are you all doing those classes concurrently with this class?
Yes, ma'am.
Okay, so all of the four of those classes are actually one, because you sometimes you may hear the health assessment instructor talking about disease process and vice versa. Everything comes together. First, you have to understand the disease process. Then you'll be able to assess the patient, and then you'll be able to administer your medications, okay? So everything is one, all right? So let's just go ahead and get started with this.
Hello and welcome to Nursing 115 Pathophysiology, Week 4. We will be covering several topics today, and we'll be looking at the tissue healing and repair, immune mechanism, the infectious process, and maladaptive changes. So when we look at, before we look at tissue healing and repair, we need to look at the infectious process. Before we look at tissue healing and repair, we need to look at the infectious process.
So let's look at inflammation.
Inflammation. Inflammation is a localized physical condition in which part of the body becomes reddened, swollen, hot, and often painful, especially as a reaction to the injury.
So let's stop there for a moment. Let's look at those words there. Inflammation is localized. That means it's in one spot. That is in one area. That's what the word localized means. Caused by a physical condition. Physical condition can be something like trauma. It could be something like a disease in which that part of the body becomes red, If you have a pen or paper, you need to write that down, because when you describe inflammation, these are the words here to describe what is inflammation. It is redden. The area is red. That's number one. The area is swollen. That's number two. It is hot and it is painful. Now, we're going to get into some details. Why is it red? Why is it swollen? What causes it to get swollen? I mean, the wasp bit me. Why should I swell? Okay, there's a pimple on my face. Why should I swell? I get hit in the face. Why should I swell? Hot, painful. Why? So those are the things that you're gonna be able to answer at the end of today. All right.
An important point here is redden, swollen, and hot. These adjectives here will become your way of explaining an infection or an inflammatory response. So if a patient comes in from an infection, you would describe the area as reddened, swollen, and hot. Then, as a nurse, you need to give description. You'll have to say slightly reddened, extremely swollen or +2 swollen, warm to touch, and often painful, meaning the patient would explain that on a scale of 1 to 10, it's a 5, it's a 3. So you'll get a description. So inflammation is a localized physical condition in which part of the body becomes reddened, swollen, hot, and very painful. It can be caused by anything, a mechanical trauma, that means someone physically gets hit, thermal injury like a burn, electrical injury, or biological disease that causes inflammations. Inflammation is an attempt by the body to remove all pathogens and heal. So if you got bitten by a dog, which will be a mechanical trauma, your question now is, what process does the body go through to remove the pathogen, the disease, the bacteria that entered into your body? We will discuss that. However, inflammation can go out of control or be more harmful than need. As such, when you look at anaphylactic shock or septic shock or neurogenic shock, this is when the body gets into the extreme. The body's fighting so much that the immune system is not winning the battle.
So just go over that again. So remember now, in my first explanation, I talked about infections. Infection is one way to get an inflammation. So not because someone say, oh, that's an inflammatory response. Remember that the inflammatory response is your body response to get rid of a pathogen. But if you are in a motor vehicle accident, is there any pathogen involved? If you get knocked out, is there like a bacteria or a virus involved in this?
No.
So why are you swelling? Why is it hot? Why is it painful? Ms. Edgecombe?
Because of damaged tissues.
Well, the tissues are damaged, but why? I mean, it's damaged, and what is the reason why it's swelling? Yeah, mic is, you need to unmute your mic, Ms. Edgecombe.
I'm reading.
No, don't read it. Try to understand. Okay, let me help you guys. Okay, this is your first class. I'm trying to redirect your mind to think like a nurse, think like a medical person. When you're hearing your lecturers, all of your lectures, regardless of which class you're in, you try to imagine what they're saying and move away from the norm, what you normally think of. Okay? So in my attempt to explain this, I said inflammation is an attempt by the body to remove all pathogens. Inflammation is an attempt of the body to heal. You see? That's the answer. Why is your body swelling when you get knocked down by a car? or when you twist your ankle. Your body, your immune system does not know, Miss Edgecombe, that there's no bacteria there. Your immune system is not set up to just look for bacteria. It's looking for anything that is abnormal. Anything that is abnormal. To twist your ankle, is that normal, Ms. Samuels? No. Is it normal? Is it normal to get hit down by a car? No. Is it normal to be obese? No. So anything that is abnormal, your body's gonna try to heal it. The scar tissue, where did you get a scar tissue from on your neck? Where did that come from? Ms. Johnson, I need to see your face, please. Where is the scar tissue coming from? The scar tissue is your body attempt to heal. See, it's right there. That's all it is. So it's either trying to remove the disease, which is the biological, or it's trying to heal the body from something that is adverse. Okay? Remember, you have what is called adverse reactions. You know, there's a class called 411 complex nursing. You guys are familiar with that. That's on your contract. When you get there, we're going to be talking about complications like anaphylactic shock, septic shock, and sepsis. Those are complications. That's your body overreacting. Remember, we are a system. We have 9 systems in our body. And our body is always trying to maintain homeostasis. And in doing that, it can hurt itself. In doing that, it can hurt itself. Please, if you have any questions, let's ask. Okay, Ms. Johnson, can you explain in your language that you've been learning, nothing that you knew before you came into nursing? You've been in nursing for 3-4 weeks now. You're in health assessment. Can you explain what you're seeing here? In nursing language, please. Ms. Allison Johnson.
In nursing language, I can see that the foot is swollen.
Mm-hmm.
It's a bit reddened. That's about it.
Okay, anybody else want to dive in? Miss Sharia Ferguson?
It looks to have fluid
Okay.
in the foot.
Okay, so let's take you back to health assessment. Everything, I'm using this word systematic. I said it before. Nobody stopped me and said, Dr. Ali, what do you mean by systematic? Everything is a systematic response in nursing. That means we do things like 1, 2, 3, 4. Like you do it in China, the person in Germany does it the same way. And when you come to the Bahamas, it's done the same way. So it's a nursing language. Okay? When if, for example, someone is pretending to be a doctor or nurse, you can pick it up because they're not speaking your language. You know, and please take that word sore, S-O-R-E, out of your language. Okay, that's not nursing. All right, you can use a word like lesion or abrasion. In this case, you want to look for location. Location. Let's have a location, please. Where's this?
What are you asking exactly, Dr.
Yeah,
Smith?
where's the location on the body?
Top left. You're talking about what you have on the screen?
Yes,
Top left foot.
Okay, now write that down, please. Top left foot. What about left dorsal extremity?
Okay.
I'm asking that question. What about left dorsal extremity? Look at those words. We both said left, right?
Yes, ma'am.
What does the word dorsal mean?
That's the top of the feet.
And what is the extremity?
That's the foot, the lower
Okay.
part.
Excellent. So now we're talking nursing language. So now we're looking at the left dorsal extremity. Low, as a matter of fact, lower extremity, eh? Right? So we need to add that, right? Left dorsal lower extremity. Now, if you walk into the room and you met a 2-year-old with his pampers off, and there's a lot of brown stuff pasted all over his body, what is it on his body? What are you going to assume that is?
That would be fecal matter.
Okay, good response. Okay, did you taste it?
No.
Okay, so everything appears in nursing. Remember that everything appears. That means it appears to be, if I say bright or dark red liquid, what am I implying?
It appears to be dark.
No, what am I implying it to be?
Blood.
Blood,
Blood.
exactly. Because I didn't drink it. I can't say there's blood all over the place, right? Everything appears to be. Okay. So if it's a large amount of brown copious matter that appears to be feces.
Okay.
Say that. All right. So it appears that this left dorsal lower extremity is, I heard the word swollen, right? The word swollen can now be replaced with the word edematous. Edematous. All right. So it is edematous. Now, when we are in describing anything, it always has a number. Ms. Henderson, it always has a number. My headache feels like a pain scale of 5. Okay, that's not like you can go to work. My headache feels like it's on a pain scale of 10. Okay, it sounds like you need to lay down and take some Tylenol. Okay, everything has a number. If we are describing edema, and I want you all these stuff that I'm telling you, just like Mr. Raming said, you go back to your textbook and read up on it. Don't come back to class next week and assume that you know. Okay, I'm giving you a piece of the pie. Edematous. Edematous is classified as 1, 2, and 3. 1 being slightly, 2 being moderately, and 3 being severe. In this case, this looks like a +3 to me. It's like a +3 to me, all right? So we'll call that a +3, appears to be moderate, extremely +3 edematous. We also can touch it. Now we can't touch her feet or his feet, but you know, when you do touch it, you press onto it. And if you have, your finger has an indentation in it, we will then say that it is a +1, +2 edema, how deep your finger stays in there. All right. So these are some good pointers for you in your health assessment class. When we talk about, we talk about inflammation now. What is the characteristic of inflammation? We talked about 4 characteristics. What are they? One is
Red.
red. Yes.
Redness,
Yes.
swelling,
Yes,
or
correct.
edema.
Hot and painful.
Hot and
Good.
Painful.
Good. Now, remember now, there's something called subjective data and there's something called objective data. Red is objective or subjective?
That's subjective.
Okay. Oh, no. Subjective means the patient telling you it's red.
Objective, sorry.
Yes, yes, yes. Swollen is objective or subjective?
Objective.
That's subjective.
Objective. That is correct. Hot is,
Subjective.
That's subjective.
Subjective.
and painful is?
Subjective.
Subjective.
Okay, good. And in everything, we need to have some numbers. So we looked at this location, left dorsal, lower extremity, appears to be +4, +3 edema, no pitting. No pitting means when you touch it, it doesn't indent. Now we need some clarification on the redness. Look at the right leg and the right foot and the left foot. Slightly red, eh? We say slightly. Slightly, it isn't deep red, it's slight. We could see some redness. Can we see it? Yeah, I could see it, right? Swollen, we've already described the swelling. Is it hot and painful to touch? So we will write, it is slightly, moderately, or severely hot. So we need to have some sort of adjective to describe it. And painful to touch. Painful, I mean the patient grimaces, the patient says, ouch, the patient says, don't do it. Okay, so all of that in a bundle gives you your assessment process. So you guys are well on your way to understanding the assessment process. Okay, so anybody want to take a stab at it? Ms. Curry, anybody want to take a stab at just summarizing what I just said about this left leg, left foot, lower extremity?
I'll try.
Go ahead.
Okay. Patient left dorsal lower extremity
Mhm.
appears to be slightly reddened, slightly to moderately swollen.
Edematous?
Edematous appears to be like +3
Yes.
and painful to touch.
Okay, great, excellent. And then you just describe what the patient says. And do you know that when you speak, you remember, okay? When you speak, you remember, you get comfortable speaking, all right? So that's very good that you came out.
Thank you.
Based on what you know about inflammation, describe the left foot. Well, how would you describe the left foot?
So we did that, right? And you know
That's
what?
good.
Okay, and you know, we went over
Did you
it.
get it all?
Yes. We actually did this video, so this would have been easy for us to understand, right? So the inflammatory response is the body's second line of defense against the invasion by pathogens. And also can be mechanical as well. Remember that, right? Why is it important that clotting factors from the circulatory system have access to the injured area? Our body is so sophisticated, guys. When you're done with this session today, you'll understand the way your body responds. When the damaged tissues release the histamines, it then increases the blood flow to the area. And then that is where you get your warmth. You remember we said it's hot. So the damaged tissue releases histamines. Then it then increases the blood flow to the area. And this is where you get that hot feeling. So this is showing you like a nail that went into the skin. And then it releases some bacteria. And then the body is responding to it.
So you got stuck with a nail. What happens? Why is it swelling? Why is it hot? Why is it red? Why is it important for your clotting factors from the circulatory system to have access to the injury? Let's look at the video and see what happens.
Okay, so anybody want to know why is it important for your circulatory system to have access to the injury?
Because your circulatory system have to send the chemical messages to the brain and hormones.
Yeah, but is there some pathogens there though? See, let's look at this here.
For your
Because,
white blood cells.
Could
You
go
know,
there and fight.
yeah, but where's the
platelets
white blood
could-
cells coming from?
They're coming from blood.
Bloodstream.
But look,
Yeah.
that's Donovan, right? That's your name, Donovan? Yes.
Yes.
Donovan, look at the back of your hand there for a moment. A lot of people like to look at that. Yeah, look at that. People like to say this is a vein. You see them two areas right there? That touch it for us, because you have some nice ones right there on your hand. Touch those veins for me right there. What's
Is it
inside? Yeah, what's inside of that?
blood?
Now tell me how that blood gets out into your, like, okay, if you outside your blood vessels. How?
Like, you mean if how it gets out of my veins?
Yeah.
I mean,
With
like, if
the
I
white
get,
blood cells, but has the blood, because you know your white blood cells is in there.
you mean if I get injured or something?
Yes,
Like if I get punctured?
yes. No, okay, just say you got attacked by a dog, the dog bit you, right?
Yes.
Or you got in a motor vehicle accident, or you broke your ankle or something. How did all that water, because that's swelling, that's where it comes from. It comes out of the blood system or the circulatory system. How did that get there without breaking? Because that your vessels did not break.
Through the vein passage right straight there.
So this is your vein here, right? This is your vein right there, right? Those nice
Okay.
veins you up there, you're showing us. And right here is the blood. You see the blood flowing in here?
Yes.
How does that come out to deal, your WBCs, how does that come out to deal with the pathogen or begin the healing process? So how does it come out of this lumen? We call this a lumen, this is a lumen.
Yeah.
Yeah, how does it come out of this?
Is it diffusion?
Diffusion?
How? Come on, tell me.
I was gonna say something along the lines of that too, with diffusion.
But did you see a
Oh.
little, did you see a little hint? It says the circulatory system.
Circulates?
That's the circulatory system, right? How does the body get into the circulatory system? And this is what you're going to learn in this video now. What happens is the body sends down something called nitrous oxide. I think I'm saying it right? And what it does, it then makes the lumens, what they call permeable. Let me see if I can get my red. Change this to red. Okay, what that mean? Still blue. Okay, let's try that. Okay, good. You see, it makes it permeable. That means it starts to stretch it out. And when it stretches out, your blood then leaks out. And inside of your blood, you will have your white blood cells, which is your fighting agents that goes to attack that pathogen or to begin healing process. So we're going to learn now about how the body causes you to have capillary leaks. Okay? Y'all did watch this video, right?
Yes, ma'am.
I hope so. It's just supposed to be a review. So the first thing you want to remember is that when you get the damaged tissue, your body releases something called histamines. Histamine causes an increased blood flow to the area. Now we need that blood to come out of the lumen with the necessary white blood cells to attack on the area, to attack the pathogen and begin the healing process. Okay.
The inflammatory response is initiated within hours of infection or wounding and is characterized by edema or swelling, heat, redness, and pain at the site of an infection or injury. These characteristics reflect 4 changes in local blood vessels. 1. The heat and redness during inflammation is the result of an increase in vascular diameter. The increase in vascular diameter also results in slower blood flow. 2. There is also an increase in vascular permeability. The endothelial cells that line the blood vessel walls are usually packed tightly together, but during inflammation they have gaps between them. This results in fluid from the blood exiting and accumulating in the local tissues, and this results in edema and pain. The fluid contains plasma proteins such as complement proteins and mannose-binding lectin, which aid in defending against pathogens. 3. Endothelial cells, which line the walls of blood vessels, are activated during inflammation. That is, endothelial cells express cell adhesion molecules that promote the binding of circulating leukocytes, otherwise known as white blood cells. 4. There is clotting in the microvessels at the site of infection, which prevents pathogens from spreading via the blood. The purpose of the inflammatory response is threefold. First, it allows the body.
I wanted to stop the video.
The inflammatory process of leukocytes leaving by other white blood cells. But what triggering tissues is called results in response is threefold. 4. There is clotting in the microvessels at the site of infection, which prevents pathogens from spreading via the blood.
Okay, so good. So what you have here is we talk about the redness and the heat, okay? What is happening there is you have an increase in diameter in that lumen, and you have a lot more blood going there because your body recognizes that it needs to bring the soldiers, it needs to bring the complements of proteins to attack those pathogens if there is any, or to begin the healing process, all right? So once that happens, then you will see the swelling in the localized area. You will see the swelling immediately, all right? Then if you look at number 2, you see the, what is called the permeability. So it actually opens up so that, not open as you see it, as you notice, like it stretches. And so now fluid now can escape out of the intravascular outside. And in it, the fluid exiting, you have your complement of proteins that are going to engulf the pathogens, all right? When it engulfs the pathogens, then it ends up in a glob. This when the leukocyte, that's where you see that white pus, that what you would see at your, or that like a white secretion at any type of infection, at a site, at an opening, all right? So you will see that immediately, or maybe 2 to 3 days later. You will notice that if it have any odor, or if it's thick and turning green, that means it's become infectious. The site has become infectious. That means the body has lost its fight against the pathogen that was there. So remember, we talk about homeostasis. Look at number 2. If blood or fluid is leaking out, are you in homeostasis? Are you balanced?
No.
No, you're not. You're not balanced. So you know what the body does? It does number 4. It does a number 4. It allows enough of those complements to leave, but then it sends down the plating, the clotting factor, to like a barrier to cover those openings for 2 reasons. Number 1, to say, okay, guys, you've done your job. Enough soldiers are out there fighting this battle. We're not going to let any more out because the body is unbalanced. And for number 2, for the bacteria that is outside that's trying to get in. Because if you open up your endothelial cells, aren't you not opening for invasive pathogens to get in? Yes. So for number 2, your body is now trying to maintain balance. After which, the leukocytes engulfs the pathogens. Now we don't need any pathogens getting into the bloodstream. The body then calls for the clotting factors, all right, to occur.
The purpose of the inflammatory response is threefold. First, it allows the body to defend itself from invading microorganisms. The increase in vascular diameter, along with the activated endothelial cells, results in leukocytes being able to attach to the endothelium, and then migrate into the tissues where they can attack pathogens. This process of leukocytes leaving the bloodstream and entering tissues is called extravasation. Second, it induces local blood clotting, and this creates a physical barrier which prevents the infection from spreading into the bloodstream. Third, it promotes the repair of injured tissue.
So all they did here is they recapped, okay? So you have the increase in diameter so that you'll have your leukocytes coming out to attack the pathogens, extravasation, and then it engulfs it. Then you notice that the bacteria on the second one is trying to come in. And you see the little X? the little X spot there, that is your clotting factor. The clotting factor is saying, no, you can't come in here. All right. And all this is happening in your body system. And body's constantly trying to repair itself. So remember, it's to stop the pathogens and to promote healing.
But what triggers the inflammatory response? The state of inflammation is set up when tissues are physically damaged, or
And tissues can be physically damaged from a sprained ankle. It could be physically damaged from a cut, like you can get a nail in there, you can get a knife or a shark bite, or you can be in a motor vehicle, anything. It doesn't have to be a disease. It does not have to be a disease.
or when pathogens are recognized by macrophages and later by other white blood cells. Either of these circumstances induces the release of a variety of inflammatory mediators which cause the inflammatory response.
So in this picture, you're seeing the mechanical and you're seeing the biological. Okay, so you're seeing the mechanical fall and you're seeing the pathogens. The body doesn't know which one it is, but all it knows, it was assaulted. Okay, so release of inflammatory mediators, which causes the inflammatory response. And your immune system is in play.
Macrophages and neutrophils secrete
Ms. Smith.
prostaglandins, leukotrienes,
Ms.
and
Smith,
Somebody said something?
Ms. Ma'am, I have a question. I learned this on the cellular level, so I want to know when does the chemokines or the cytokines get involved in the
When you,
process? Like how you
yeah,
explain it?
yes, it gets involved when you remember I talked about 411 class? When you have a alteration, when the body cannot fight it anymore. So it gets into the extreme. When you're going into septic shock, the body releases that.
Oh, so
Okay. So for
when
now,
the histamine, so I'm asking, when the histamines and the prostaglandins and the bradykinins or the kinins react after the first, when the inflammation is starting, there are no chemical messages sent in then.
yeah. So what happens then? The chemical message is sent to say there's damaged tissue. And what comes on the scene is your macrophages and your neutrophils. So that comes, that's at the beginning. We are at the very beginning of what is going to be a normal healing process. Now, remember on that last slide where the platelet came in as a barrier, okay? When your platelet cells start to drop, okay? When your platelet count start to drop, and you cannot control that barrier anymore, and those pathogens come in. Once the pathogen gets into the bloodstream, it's going to start multiplying. So your body now has to bring on another level of support.
And platelet activating factor, or PAF, which are lipid mediators of inflammation. These are produced rapidly because they are made from degraded membrane phospholipids. Then,
oh, by the way, did anybody see the word neutrophil there a few minutes ago? Remember, guys, you guys are in pathophysiology. If you don't understand a word, a term, make sure after class you go and read it up. Neutrophils are like baby white blood cells. What does this mean to you? You remember last week when we talked about the disease process and we talk about treatments and we talk about the labs. We say, okay, now, after you've done your assessment and so forth, you're then gonna do your subjective and objective, and then you're gonna look at the labs, your diagnostics. So labs will tell you that your white blood cell count is high. So if your white blood cells count is high, that means the body is sending out white blood cells to attack this pathogen. That means there's more than likely there may be an inflammatory response going on. Your immune system is activated. What is important here to notice, especially to you, Mr. Rami, is if you have high neutrophils. Now, if I say to you that neutrophils are baby white blood cells, but you have high, a lot of white blood cells and high amount of neutrophils, what does that mean to you? Anybody could try to imagine what you think is happening in this body? do you normally have more babies than parents? Like, or adults, I should say? No. If you go into war, would you have more adults or you'll have more children?
Adults.
No,
Yes.
adult.
Right. So think of the white blood cells as the adults and the neutrophils are the children. They're baby white blood cells. They're immature. So why is it that you have all this high amount of neutrophils?
The adults died off.
Because what happened is the adults are fighting this battle so much now we need to call in the neutrophils. So anytime you see a neutrophils are equally high as it is with the WBCs, once again, get to know what your WBC count is, 5,000 to 10,000. Know your numbers, labs, as a part of
11,000 too. It could be up to 11,000.
Yeah, now 5,000 to 10,000. And remember, some textbooks and some lab sources, they are different, okay? Not much. And this is why you always use your reference source. Anytime you look at a lab, they always have their reference source, meaning that, Kelso lab may have it to 12,000, which I've never seen, I'm just saying that. But the number that they have there will tell you that, okay? So yes. So here now you can see that the macrophages secrete the cytokines, and this is where the substance released by the cells of the immune system. Okay, so in that last video, we saw that the neutrophils.
And macrophages secrete cytokines, which are substances released by cells of the immune system that affect other cells. One kind of cytokine are chemokines, which act as chemoattractants. Chemokines cause directed chemotaxis, which is the movement of cells or parts of cells in a direction corresponding to a gradient of increasing or decreasing concentration of a substance. In the case of chemokines, they direct phagocytes to move towards the source of the chemokines, which is where they are needed. Now I'd like to point out two cytokines important to the inflammatory response, C5a and tumor necrosis factor alpha, or TNF-alpha. The complement fragment C5a plays multiple important roles in the inflammatory response. For instance, it stimulates respiratory or oxidative burst, which is the rapid release of reactive oxygen species. At the same time, it attracts neutrophils and monocytes, so it essentially preps them for battle as they arrive. It also increases vascular permeability, increases expression of certain adhesion molecules on the endothelium, and causes local mast cells to release granules containing the inflammatory molecule histamine and TNF-alpha. TNF-alpha is also an important cytokine, which is produced rapidly by macrophages upon pathogen detection, and is a potent activator of endothelial cells. Activation of endothelial cells is central to the inflammatory response. Cytokines produced by macrophages, especially TNF-alpha, cause endothelial cells to rapidly externalize granules called Weibel pallid bodies within minutes of pathogen detection by macrophages. Weibel pallid bodies contain preformed P-selectin, which now appears on the surface of local endothelial cells. Selectins are one of three structural families of adhesion molecules important for leukocyte recruitment, with the other two being intercellular adhesion molecules, ICAMs, and leukocyte integrins. Later, within 2 hours of pathogen detection, the endothelial cells primarily express E-selectin. This is because shortly after P-selectin gets to the cell surface, mRNA encoding E-selectin is synthesized. Both selectins interact with the sulfated Cialyl-Lewis X that is present on the surface of neutrophils. Once inflammation has begun, neutrophils make up the first wave of cells that cross the blood vessel wall to enter an inflamed tissue. After this, monocytes cross the blood vessel wall and differentiate into tissue macrophages. In later stages of inflammation, other leukocytes such as eosinophils and lymphocytes also enter the infected site. Usually, leukocytes travel in the center of small blood vessels, where blood flow is fastest. However, in inflamed tissues, the slower blood flow allows leukocytes to interact in large numbers with the endothelial cells lining the blood vessels. In addition, injury to blood vessels triggers two enzyme cascades, the kinin cascade and the coagulation cascade. In brief, the kinin system consists of plasma proteases. A protease cascade features enzymes that are initially inactive. Activation of one enzyme triggers cleavage and activation of the next enzyme in the cascade, and so on. The eventual result of this cascade is the production of several inflammatory mediators, including bradykinin, a vasoactive peptide that increases vascular permeability and causes pain. Pain is an important part of the inflammatory response because it makes you aware of the problem and causes you to immobilize that part of your body, helping prevent the spread of infection. The coagulation system is another protease cascade whose activation leads to formation of a fibrin clot. This prevents blood loss in the case of blood vessel damage and physically blocks the spread of pathogens in the case of infection. If you enjoyed this video, like and subscribe.
I know you all enjoyed that video, right? It took you to another level, right? All they're saying to you is this, in a nutshell, is that your body detected a pathogen or an assault. Then your body releases histamine. Now you're gonna find histamine coming up again, and in your asthma and your respiratory disease and all those your airway disease, histamine and your allergies. You're gonna hear that again. Your body releases the histamine and say, "Hey, there's a problem." All right. Your body then begins to produce what is called nitrous. They didn't this video, they didn't talk about the nitrous oxide, but the nitrous oxide is what begins to soften the vascular system. It begins to make that membrane permeable so that these your immune system, your neutrophils, your monocytes, your lymphocytes can now go and engulf or start the healing process. In the meanwhile, the body then has to maintain homeostasis. And in maintaining homeostasis, you then have to activate your fibrinogen system. Okay, so that is where you see your platelets now coming in. And your platelets are going to act as that barrier to stop the leakage, the capillary leaks, and to stop the pathogen from entering into the bloodstream. That's all in a nutshell.
Okay, so get a piece of paper and write the purpose of the inflammatory response. What is extravasation? Go ahead and describe extravasation. And what is the purpose? What is the body trying to do in the inflammatory response? What is the body trying to do in the inflammatory response? Describe extravasation. And what is the purpose of the inflammatory response? Go ahead, write those out.
So there are stages.
So let's look at the stages here. The acute inflammatory response is made up of a few stages. Damaged cells release histamine, which triggers the inflammatory response. Histamine causes blood vessels to become more permeable. Blood vessels around the area becomes leaky, which allows the exudate to be released. First, exudate from the local blood vessel leaks into the damaged area. Exudate is made up of protein, fluid, and cells. So what is exudate made up of? Exudate is made up of protein, fluid, and cells. Histamine causes the blood vessels to become more permeable. Remember now, the pathogen is inside of the blood vessel and it needs to get to the actual infection, a site, the infected site. For it to get there, the blood vessels has to become permeable. That means open so that the pathogens can get to it.
And that's actually an error in there. I just heard that. It's not the pathogen. It's actually the you have your neutrophils and your monocytes are trying to stop the pathogens from getting in. I hope somebody picked that up. I just picked that up just now.
Fluid contains salt and proteins, such as immunoglobulins. Fibrin is a type of protein in the exudate, which helps with blood clotting. You remember that question I asked earlier? White blood cells are also contained in the exudates. Its function is to control the defenses around the site of the damage. So what happens is,
So exudate is another term you need to learn. That's like some thick secretions that you will see coming out of wounds or open areas. And inside of that, you know what's in it. You have fluids, salts, proteins, your immunoglobulins inside of that.
once the pathogen is inside of the body then has a response. It sends the white blood cells to control the amount of pathogens replicating at the site. So as you advance into nursing, you would hear that the majority of times the person has an infection, their white blood cells will be high. Their white blood cell count will be high because that is the body defense, that the body is sending the exudate, which contains white blood cells, to the site. The white blood cells in the exudate are to destroy any pathogens in the area. Tissue that is damaged by the injury is broken down and taken away. So all that crust that you see around the site, it is then broken down and taken away in the body. Inflammation presents in a few ways, as we discussed. When you described that left foot, did you say it had heat? Well, we couldn't see it, but we expect for it to be warm, pain, and swollen. Redness and heat are due to the vessel dilating and increase in blood flow. So the blood vessels are dilating at the site, and there's an increase in blood flow to the area. So why are we experiencing pain? Pain is due to an increased pressure on the neurons, that is your nerve endings, from the swelling. Remember, if your nerve endings are sitting there in a space, now it's competing with fluid in the area. So that means that nerve endings are being compressed on. So the pain is due to increased pressure on those neurons from the swelling. So when the swelling goes down, we expect that what would happen? That's right, the pain would decrease. And the efforts of some of the chemicals released during the inflammatory process. The buildup of exudate produced the swelling. So what causes the swelling? All that exudate. What is in the exudate again? That's right. The pain is due to increased pressure on the neurons from the swelling and the effects of all of that chemical going down to the inflammatory site. What happened?
So remember in the norm, okay, Donovan held up his hand just now. There was no swelling, no obvious appearance of redness on his hand. So we will assume that he doesn't have any type of inflammation going on. Okay, that's normal. So his hands, when you look at his hands, it is not competing for space. You don't have fluid competing for space. You don't have oxygen competing for space. So remember now, our bodies thrive on oxygenation, our bodies thrive on glucose, and thrive on the inflammatory process. So if he damages his hands mechanically, you will see the inflammatory response occurring, where you will see the fluid going directly. Well, obviously, macrophages and neutrophils and monocyte cannot move on its own. It needs fluid to carry it. And that's where you have that excess of fluid going there, and you have the swelling. Now you have swelling compacted in an area that was free. There was no pressure on the nerve endings. There was no bradykinin going on. And so therefore, the patient will not be experiencing pain prior to that. So now he has all that swelling, and the system is now pressing, the fluid is now pressing onto the nerve endings, and the patient now is going to be experiencing pain. So that's the body way of competing. So what are some of the signs and symptoms of pain? You could tell that your patient is in pain by grimacing. Grimacing is a word that you need to learn. Grimacing, facial grimacing, clenching their teeth, holding on, moaning, all right? But subjectively, the patient will say, I'm in pain, on a scale of 1 to 10. But objectively, you can see that. You're going to see, assume, appears to be in pain. But when you look at his or her vital signs, okay? Fever causes increased heart rate and respirations, as well as pain. Pain is the sixth vital sign. So when you look at it, the fifth vital sign. So when you look at the patient, you also want to assess for pain. Rapid pulse and fever are also a sign of inflammation. The patient may have generalized malaise as tiredness. Pain to the inflamed area, of course, because we understand that that fluid is competing for fluid and it's pressing on the neurons. Should the cause of the inflammation be brief, such as a small splinter? Yes, a small splinter can cause it. When you look, when you get a splinter in your finger, it hurts. It really does, doesn't it? Because that's your nerve endings. Inflammation goes away within 48 hours. So something that is very brief and minor, your body responds to it, as simple as a splinter.
Okay, so based on the video and the last 3 slides on stages, I need you now to go over the video again, review those last 3 slides, and in your review, identify acute, subacute, and chronic. So I gave a description in the last 3 slides. I need you to identify, was that the swelling stage? Go ahead and put that information in there. Is it the subacute, the regenerative stage? And remember I talk about tissues, damaged tissues being moved. Is that the chronic or is that the subacute?
So obviously when you have an injury, you'll see the swelling, right? The body has two things. It's either going to repair it or they're going to try to take away the pathogens, right? So the first thing in repairing, it's going to send those neutrophils, monocytes, and lymphocytes to the site with a lot of fluid, all right? The cells are going to become permeable. The patient's going to be in pain because of all that fluid. So that obviously is the acute stage, huh? Within 48 hours, 2 days max on a mild injury, you will see that patient go into what's called a regenerative stage. That's the subacute phase. And if there was some opening, that goes into the chronic. So you see the scar tissue. So the tissue, the body starts to heal and repair itself, and that's the remodeling stage. That's if you have an opening in the system. The 4 cardinal inflammation signs are ruba, which is for Latin, heat, which is color, and swelling, which is tumor, and pain, which is dolor. Now we're learning Latin, right? Let's go. Somebody help me to do the screen here. Swelling and edema. Let me do this now. Pain is what? I can't hear you. I can't hear you guys. I can let you guys read through this, Ms. Roxanne. I can let y'all do this on your own. This is a good time for y'all to interact in the class, okay?
It's associated with inflammation.
Okay, good. I just moved away from it. Okay. Inflammation, so we're gonna go into the healing process, now.
So is the inflammatory process good or bad?
Is
Is
it?
it good or bad? Think
Is it?
about that for me.
Is it good or bad?
Good.
Why you say it's
It's
good?
good.
I mean, it can be good and bad. I would
Yes,
say good to let your body know what's going on,
right?
and then bad because it's the area is inflamed.
Yes.
And
Yeah, because do you know that inflammation, the body attacks itself because it sees inflammation, even though, it's turning up the heat inside, right? And then it's saying something is not right. So it's then trying to attack itself on the heat itself. Okay. So yes. And remember, when you have a lot of platelet cells going down, what's going to happen? You're going to have loss when your platelets start to decrease because you're trying to block all of those leaking capillaries. You're now going to have that those are actually clots that the body is sending there to stop those leakage. So what do you think when you have all of those clots trying to stop the leakage? What do you think is going to happen? It could break off. It could go to the brain, heart, and lungs. You end up with a brain attack, which is a stroke or a heart attack. Here's another thing. If you have a broken femur, right? And the inflammatory response occurs, the patient's thigh becomes big, red, and painful. One of the stages in the inflammatory response is for the lumens to become permeable, right? And then it sends out the neutrophils and lymphocytes to engulf the pathogen or begin the healing process. That's correct, huh? The next stage is that the body does what? Sends platelets to do what? Stop that leak. Do you think that that is only happening in the femur? Or do you think it's happening in the lungs and in the brain and in the heart everywhere else?
It's systemic, right?
Because
No, it's localized.
think about that. Who said it's localized?
That's systemic.
Who says localized?
That's
Mr.
what you say, man. It's a localized process.
Is localized process, right? That process where that area is swollen. But my question is, do you think that the permeability is only occurring in that area? No.
No, it's not.
Your entire body is permeable. Your entire body becomes permeable. That's why you have aches and pains. When people say, I feel achy and painful, okay? Because the entire, remember now, your circulatory system is connected. So when you have that systemic release of histamine, the body is smart, but it isn't that smart to say, oh, I'm only going to the femur. You see? However,
Well, Ms. Smith, I'd say I only feel pain in that area. That's what
no,
I'd
the
say.
pain, no, remember now, like watch this here, it's 4 stages. I said that the histamine is released, right? It knows the target area. That's why the swelling occurs in the left femur, okay? The swelling is there. That swelling part is fine. I'm talking about the permeability of the entire vasculature system occurs at the same time. It happens at the same time throughout your body. So it's not just unlocking that spot, it's the entire body that's going through that.
So you're saying extravasation happens throughout the whole body at the same time?
Yeah, it is localized, right? And then your body moves to, remember this, then your body sends the platelets to that area, it cuts it off, and then you know what happens? It normalizes. This is where sepsis occur and septic shock occur, because your entire vasculature system will collapse. That's why your entire vasculature system collapses when your body doesn't win the battle. So hopefully your body is healthy enough to regenerate and stop the pathogens at that very localized spot so that it does not become systemic. So your entire vasculature is connected. So here is the thing now. When they say, is it a good thing and a bad thing? It is a good thing, but it's a bad thing if your body overreacts itself. If your body overreacts. I don't know if you guys are hearing anything much about COVID-19, which is an inflammatory process, by the way, and an infectious disease. But persons who would have had that systemic disease, who had other injuries before, like if they had a knee injury, a shoulder injury, they have what is called long haulers. Their body is now waking up where it was sleeping. And those persons are now complaining about those same past injuries, because the body didn't realize that it was just the COVID it was dealing with. It started dealing with all those other things once again. You see?
Minute. Well, in
Miss
some
Smith, I only
instances,
say one
inflammation can
last
cause
thing.
harm.
That's a negative feedback system, right? That's a negative feedback system happening, and we studied that. If you look at that person's leg that you showed us in the beginning, if you look at the left leg, that left leg really swollen heavy. That right leg is not going through what that left leg going through at all. I mean,
No.
on my judgment,
No.
objective judgment, but I take your word for it. But I'm just saying that in that negative feedback process, it's like for you to say that everything is feeling the same thing at the same time, looking at that right leg with all them veins in it, as skinny as that is, and then the left leg is really swollen, 3+ edematous. Then I mean, it's sort of it's sort of mind-boggling.
Yes. Your entire body goes through vasodilation. The entire body goes through, your body just doesn't vasodilate in the leg, in that left leg. Remember, we are on the 4th stage. See, the 1st and 2nd stage, they understand, the body understands it's localized. But when you reach that 4th stage, where you are between the 3rd and 4th stage, where the blood becomes permeable and you start to leak, okay? If your body does not heal itself or the pathogens is not under control, the entire system collapses. And this is what the question you had asked me earlier. This is when the cytokines releases itself, it becomes more vasodilated, the blood pressure drops, and the patient goes into septic shock. That is the next stage. That's what happens. Because the entire system collapses, vasodilates. You have dysregulation. That's what it's called, actually. Dysregulation occurs. So it is good and it's bad, meaning that if your body does not return to homeostasis, then it goes into what you call the negative. The patient will go into a dysregulation. The body becomes confused. And then you go into septic shock. That is septic shock, by the way.
Tissue destruction can occur when the regulatory mechanism of the inflammatory response are defective or the ability to clear damaged tissue and foreign substances is impaired. So this will happen when you hear the person's immune system is low, and therefore the pathogens will take over and the person will die from that disease. In other cases, an inappropriate immune response may give rise to prolonged and damaging inflammatory response.
Okay, and this is it right here.
So as you hear people talk about COVID-19, persons who have already had it and they are recovered, they are talking about side effects, things that happened or is happening to them after they would have had a negative test and they are no longer COVID-19 positive. So this happens. In autoimmune reactions, the body immune system attacks its own tissue, leading to long-term chronic inflammation. So persons who have lupus, for example, will fall under this category. So the body continually attacks itself. It's called an autoimmune disease. Automatically immune, the immune system is attacking itself. Although acute inflammation is usually beneficial, it often causes unpleasant sensation. So, such as pain. You've had a sore throat before. It was very painful, right? So, what was causing that pain? Go back to the slide before. What is causing that pain? Or itching of an insect bite. So, you got bit by an ant. Why is it itching? Think about that histamine. Think about what's happening at the site. Discomfort is usually temporary and disappears when the inflammatory response has done its job. But in some instances, inflammation can harm and cause severe tissue destruction. Tissue destruction can occur when the regulatory mechanism of the inflammatory response are defective or the ability to clear damaged tissue and foreign substances is impaired. What stage would you find the body trying to remove defective tissue and foreign substances from the body?
What phase? You all awake tonight?
So what then is suppuration? Suppuration is the process of pus formation that occurs when the agent that provoked the inflammatory process is difficult to eliminate. So we have virus.
So that's what you will notice days after the person would have had an invasive injury, like a nail or a cut or some sort of wound. You see pus forming at the site. First, you probably might have seen like clear, what they call serosanguinous secretion at the site, maybe for the first 2 to 3 days, and then you may see pus accumulate. So that means that the body failed to remove that invasive the pathogen at that time in an adequate time.
You have bacteria, you have fungus. It's difficult. So what happens? Pus comes out. Now, if you think about something that causes pus, as simple as an acne. Pus is a viscous fluid, liquid, that consists mostly of dead and dying neutrophils and bacteria, cellular debris, and fluid leaked from the blood vessels.
So now we know what is pus, and we know what pus looks like, that yellow, thick discharge. When you're writing it as a nurse, you're going to say viscous, and you're going to describe the color, whether it's green, white, slightly yellow. And what is it? That is the result of the battle. It is the dying neutrophils that has engulfed the bacteria, the cellular debris, the fluid leak from the blood vessels. That is a combination of what's in there. Suppuration.
So what's inside of this pus? Pus is a thick, that's what viscous means, fluid that consists of dead and dying neutrophils. That's your white blood cells. That's the battle scene where you have the white blood cells against the bacteria. And this fluid leaked from the blood vessel. The most common cause of this can be seen in bacteria, such as your staphylococcus and your streptococcus. Those are bacterial infections, staphylo and streptococcus. So if you had a strep throat, once pus begins to collect in the tissue, it becomes surrounded by a membrane, giving rise to a structure called abscess. So what do you hear your grandmother calls it? She says boil. Okay. Or you may say a sore, but remember in nursing, we don't use those words. We're going to use the medical terminology, which is abscess. Because an abscess is virtually inaccessible to the antibodies and antibiotics. Remember, it's in a sac, it's in a membrane. So the antibiotic is not getting into it. It is very difficult to treat. Sometimes a surgical incision is necessary to drain and eliminate it. So why do you think someone, they're shaving and they use a bad infected razor blade and they get a abscess under their arm and it gets bigger, it's painful, it's red, it's swollen. They take the antibiotics, it's not working. Why? Because it's enclosed in a membrane. So the doctors have to go and they'll have to lance it. Some abscesses, yeah, there you go, such as boils, can burst of their own accord. You see that in your pimples. The abscess cavity then collapses and the tissue is replaced through the process of repair. And that is when we look at a couple of slides ago when we talk about the stages. Okay. And
so when we look at abscess, when I said earlier, I was going to say when she said, when I said that it bursts, on its own accord, because what happened is the body sees the abscess, mind you, as an invasive pathogen. And so what it does, once again, the area becomes permeable again, and then it softens. It softens, and then the membrane leaks, and we call it burst, but it leaks out. All right. Think about that question that I asked. A lot of you may have had it before, where you use these razor blades and then you get abscess under your arms. You're taking antibiotics, it doesn't work. That's because the bacteria is actually safe and sound in that little sac, okay, in that abscess. So Lyle is a, once again, remember, as you do nursing, you're going to be thinking about pharmacology, assessment, nursing process. You're going to be thinking about the pathophysiology, the etiology. And so everything comes together. We're not, and then pharmacology as well. Everything comes together. So this 10-year-old boy, first as a boy, you're going to learn that, we learned about that earlier this week, that sex plays an importance, age plays an importance. So this is a 10-year-old boy in very good health. He went to a birthday party on Sunday with his family, and he ate many different foods, but was the only one in the family to eat the undercooked hot dog served by the host. Monday morning, he woke up feeling achy and nauseous, okay? He has a runny nose, a running fever of 100.4. His parents assumed he had caught the flu, made him stay home from school and his activities. But after 4 days, he began to experience severe headaches and his fever spiked. Now, remember, your head is like a coconut. You know, people say you have a coconut head, right? Water, you could put water on top of a coconut, nothing happens, okay? What happens is, in your cavity, in the skull, and you have a cavity between the brain and the skull, which you have your fluids, okay? If you have a change in homeostasis, that means more fluid because of an infection, right? Traveling, and it travels, and it has to, remember, it's not, remember, this is the same thing I'm talking about, Rami, is not only in the leg. That extra fluid now has to go up to the brain. You see, it still has to go there, right? So what happens now, the body senses that extra fluid passing through the in that cavity, that extra pressure, and you end up with something called a headache. That is where it's coming from, that extra pressure that's coming in there because of the inflammatory process. So the parents are growing worried and finally decide to take him to a clinic. What signs and symptoms is he experiencing? So we already know that he has nausea. Let me tell you something, nausea, everybody gets nauseous. You in a car ride is nauseous. You're pregnant, you're nauseous. You smell bad food, perfume, you're nauseous. Nauseous is just one little old symptom. You just cannot say, okay, I feel nauseous, right? We need to ask some more questions. And we already know that he ate some undercooked hot dogs. We're thinking the differential diagnosis here. Okay, I'm thinking food poisoning, right? Undercooked. He's the only one in the family because food poisoning comes like, it's like flu-like symptoms, okay? Pain, joint pains, because it's an inflammatory response. It's been 4 days now, and he's had a fever that moves from low grade to a fever of 104. Now, as you guys will get to know about nursing, children, especially the younger ones, they could play through fevers. But when you see a young child of age 5 and younger stop playing, then we know this is serious. They're not taking on their bottle, or they're not playing with their toys, not laughing and playing around. It is serious. So a 10-year-old wants to stay home. He wants to stay home. This is fun time not to go to school. So for him to be laying down there, Lyle has a problem. What do these signs and symptoms tell us about the stages of his disease? Okay, is he in acute, subacute? What stage is he in? What stage, Ms. Farquharson, anybody?
He's in the acute stage.
Yeah, it sounds that way to me too. Okay, a disease, we know that, is any condition in which the normal structure or function of the body are damaged or impaired. Physical injuries or disabilities are not classified as disease, but they can be several causes for the disease, including infection by a pathogen, genetics, as in many cancers or deficiencies, non-infectious environmental causes, or inappropriate immune responses. Because remember now, our bodies just overreact sometimes. So we will focus on the infectious disease. Although when diagnosing infectious disease, it's important to consider possible non-infectious causes as well. So signs and symptoms, any infection is the successful colonization of the host. So you remember now, our platelets were supposed to go down there, our membranes are supposed to become permeable and block it off, okay? So if that host gets in there and colonizes, then it multiplies, like what we will see in COVID-19. I asked you all that question when I first met you guys. Is COVID-19 a living organism? No, it's not. It needs to get into our bodies. And then it needs to come in and replicate itself. Infections can lead to disease, which cause signs and symptoms resulting in deviation, resulting from that hemostasis from the normal body. Microorganisms, that's our pathogens, can cause disease. The signs of disease are objective. That means you could put a number to it. And measurable. Numbers. So a fever is not measurable. You have to say it. You have to say 104 for more than 6 hours. Or the patient is 98.6. That defines it. So remember, everything that you know about nursing has to have a number. Hot has to have some sort of adjective to describe it. Red has to have some adjective to describe it. So when we look at the signs that are objective and measurable and can be directly observed by you, the clinician, vital signs can be measured and include temperatures, which is normally 98.6, heart rate, which is normally 60 to 100 beats. If it is an adult, because you know children heart rates are higher, respirations in children are higher. So this is an adult, 12 to 18, and blood pressure between 90 to over 60 to 120 over 80. Changes in any of the body vital sign may be indicative of something happening. For example, having a fever is a sign of something happening. Having a headache is a sign of something happening. Stress is, we talked about stress. We put that in the category last week, didn't we? In addition to changes in vital signs, other observable conditions may be considered. For example, the presence of antibodies in the patient's serum. So remember I said to you guys, after you do your subjective and objective assessment, you need to add in some labs. We need to put the labs there. All right, so we can then correlate that lab to what we are finding. Unlike signs, symptoms of disease are subjective. That means the patients are going to be telling us that. Symptoms are felt or experienced by the patient, but they cannot be clinically confirmed. So someone can say, I feel nauseous. How do you measure that in a blood tube? Right? Now, nausea normally comes with vomiting, right? So nauseous and vomiting, so you might then see objectively that the patient is expelling large amount of copious white secretions. That means he's probably vomiting. All right, loss of appetite and pain are symptoms as well. Such symptoms are important to consider when you're diagnosing the disease. Our little Lyle did have a fever, we know that. Some clinicians attempt to quantify symptoms by asking this patient on a scale of 1 to 10, describe your nausea, describe your pain. How many days have you felt like you've lost your appetite? What happens when you say you've lost your appetite? All right. Oh, this here is my what you call terminology. Guys, I need you guys to know this stuff. Okay, I'm not gonna go over this, but you still have access to this, so you can go ahead and make sure you know your the meaning of lysis, the meaning of cyto. Emia, what does that mean? Okay. When we look at this man here, he has a appearance of what?
He looks confused.
Okay, confused could be one. I was thinking others, but go ahead. I confused. We could go with that.
They have a headache.
He looks in pain
He looks like
already.
he looks like he appears to be in pain. Yes. What else?
He appears to be stressed too. I mean,
Yes, as a matter of fact, that was the first thing. That's the first thing that came to my mind. Okay, so we have pain, we have stress, and someone said confusion. So we need to ask some questions, and that's where you go into your health history. You know, what is today's date? Who is the prime minister? Where are you? What's your name? Okay, to get that confusion out of him, right? Tell me why you are here, because we can begin the conversation on stress. You know, pain. You could come right out and ask him, are you having any pain? Come right out and ask that question. Are you having any pain? All right. So think about it. Describe how a disease can be infectious but not contagious. Explain the difference between hydrogenic disease and nosocomial disease. We talked about that last week, actually. Y'all went to the clinics yet? Y'all went to, are you guys going to Sandilands?
hopefully.
Well, anyone who doesn't work in the medical field, be prepared to be sick when you get there. Right, Ms. Farquharson? Because your body is gonna, anything you touch, your body's gonna find that to be like a defense, okay? It's gonna find itself saying that, you know, I don't like what I'm feeling, and it's gonna build up a defense, all right? So think about it. Describe a disease that can be infectious but not contagious. Anybody can think about that?
Is HIV one?
Yeah,
Oh,
I was saying
that's
that.
Yes, that could be one.
Okay.
And also to the same food poisoning that we're about to talk about, right? So let's look at Lyle. Based on your understanding of the disease process, can you fill out the blank and define the disease Lyle may have? I think I already told you that it's food poisoning. So food poisoning is a what? Hmm?
That's an infectious disease, but it's not contagious.
So go back to those slides that we had the other day. Is it a condition? Is it a disease? Is it a disorder? Is it a syndrome? What is it?
Can you name them off again, please?
I want you to start thinking off of what it is. But I want you, while we online, I mean, you could go on your computer and ask the computer, you know, is food poisoning an infection? You could ask the computer, your computer's smart. But I'm going to leave you guys with this because this is something you all should have watched that day. Everybody should have already had this. So it is a blank caused by blank. See, everything is, remember I said, when we do the definition of a disease, this is how you would describe it. What causes food poisoning? Now, there are many bacterias and parasites and fungus that can cause it. But when you look at undercooked hot dog, what bacteria?
Staphylococcus, or staphylococcal.
It could be Staph aureus, as you said. Staphylococcal is more skin.
I think, is it E? It starts with the E. I can't remember.
Okay. So it's
Starts with
caused
an E.
by something, right? Okay, so just say, I'm gonna say parasite. I'm just gonna use that word, right? With clinical manifestation of what? What do you see manifesting? Does the person have itchy skin, dry eyes, loss of hair? So you want to give yourself about 3 different clinical manifestations, because remember now, a headache is not one, nausea is not one. You need more than a headache and a nausea. Remember, I used parasite, I meant to use parasite, okay? Because I want you guys to figure it out, but I'm going to come back and explain something. It could be caused by E. coli as well, that's right, right? With predisposing, because you're going to ask yourself, did Lyle wash his hands? Did he use the bathroom before he went in there, right? With predisposing factors of what? Now, just say it was E. coli. Predisposing factors would be washing your hand, counting money, like I went to the food stand, which I don't normally like to go to. I went to one on Saturday, and I had to tell the girl, I said, look, please wash your hand when you're dealing with money and taking up food. And she knew it. She said, yes, ma'am. She knew what she was doing was wrong. But I wanted to use parasite because the treatment now, you're treating the cause. If the cause is parasite, you need to use a parasitic agent. In this case, it's not parasitic, but I just wanted to use that, okay? So you need to fill that out. You don't need to send me this via email. This is for you to do. As you begin to know me, when I tell you to do something and you don't do it, I am 100% sure you will see it on an exam. It happens all the time, okay? So we already did homeostasis, but we're going to be looking at fluid balance and hematologic alterations next week, okay? Any questions?
Yes, and our first quiz supposed to be on the 26th. Is that still
Is it the
on?
26th?
It's the 28th, Mr. Ramming.
No, it's the Saturday. It's the Saturday, whatever Saturday class is. I mean, the Sunday, sorry, whatever Sunday is.
Is that going to be on Moodle?
Yeah, it's going to be on Moodle. What day is Sunday?
26.
26.
Okay, all right, yeah, it's the Sunday after class.
That's the 26th.
Mm-hmm.
What time would it be?
I think I told you all 8 p.m.
Do you mind me asking how long it's going to be on Dr. Smith?
About 40 minutes, just a quiz.
Okay.
Multiple
Can I
choice.
ask another question? Is it MCQs or?
Yes, multiple choice. Mm-hmm.
Okay, thank you so much.
Mm-hmm. Okay, guys, with that being said, you guys have a wonderful